What happens when depressive disorder goes untreated? Depressive disorder, particularly major depressive disorder, MDD, or persistent depressive disorder, dysthymia, is a serious mental health condition that affects millions of people worldwide. Left untreated, depression can have profound effects on nearly every aspect of an individual's life. The consequences of untreated depression can range from physical health problems to emotional suffering and social difficulties, and may even increase the risk of more severe mental health conditions. In this article, we will explore the potential consequences of untreated depressive disorder, including its impact on relationships, physical health, mental health, and quality of life. 1. Worsening of symptoms. One of the most significant risks of leaving depression untreated is the worsening of symptoms. Depression does not tend to improve on its own without treatment, and in fact, its severity often increases over time. Chronic symptoms. In cases of persistent depressive disorder, dysthymia, untreated symptoms can persist for years. The person may continue to experience long-lasting sadness, lack of motivation, and an inability to find joy in life. Severe depressive episodes. For people with major depressive disorder, MDD, untreated depression can lead to more intense and frequent episodes. These episodes may last longer, have a greater impact on functioning, and may include symptoms such as suicidal thoughts, extreme hopelessness, and excessive guilt. Cognitive impairments. As depression worsens, cognitive function can be impaired. Individuals may have trouble concentrating, making decisions, or retaining information. This mental fog can further affect work, personal responsibilities, and social interactions. Key insight. Left untreated, depression can become more intense, harder to manage, and more likely to interfere with daily life and long-term well-being. 2. Physical health problems. Depression not only affects mental and emotional well-being, but it can also take a significant toll on physical health. The connection between mental and physical health is well documented, and untreated depression can contribute to various medical conditions. Weakened immune system. Depression has been shown to weaken the immune system, making individuals more susceptible to illnesses such as cold, flu, and more serious infections. Chronic stress caused by untreated depression can impair the body's ability to fight off pathogens. Sleep disturbances. Depression often causes sleep problems, including insomnia, difficulty falling or staying asleep, or hypersomnia, sleeping too much. These sleep disturbances can contribute to further health issues, including fatigue, headaches, and increased risk for heart disease. Chronic pain. People with depression are more likely to experience physical pain and discomfort, such as back pain, joint pain, or stomach problems. The mental strain of depression can amplify the perception of physical pain, making it harder to cope with both the emotional and physical symptoms. Risk of cardiovascular disease. Chronic depression has been linked to an increased risk of heart disease, high blood pressure, and other cardiovascular problems. The stress hormone cortisol, which is elevated in depression, can contribute to the development of these issues over time. Key insight. Untreated depression can contribute to a range of physical health problems, which may exacerbate the emotional strain of the disorder, creating a vicious cycle that's difficult to break. 3. Relationship and social difficulties. Depression can have a profound impact on relationships, causing tension, emotional distance, and even social isolation. The withdrawal and emotional detachment common in depression can create significant strain on both personal and professional relationships. Social withdrawal. People with untreated depression often withdraw from social interactions. They may stop seeing friends, attending family events, or participating in activities they once enjoyed. This isolation can lead to feelings of loneliness and rejection. Strained communication. Depression can make communication difficult. Individuals may struggle to express their emotions or needs, or they may become irritable and defensive. Loved ones may feel frustrated or hurt, not understanding the root cause of the behavior. Relationship breakdowns. In romantic relationships, depression can lead to a lack of intimacy, emotional distance, and communication breakdowns. The depressed individual may feel like a burden, leading to guilt and further withdrawal. If untreated, these dynamics can result in relationship breakdowns or even breakups. Key insight. Untreated depression can cause emotional disconnection and isolation, which can weaken existing relationships and prevent the person from seeking the social support they need to heal. 4. Increased risk of substance abuse. Many individuals struggling with untreated depression turn to substance use as a way to cope with their emotional pain. This can lead to substance abuse or addiction, which only worsens the effects of depression. Self-medication. People with depression may use alcohol, drugs, or other substances to numb their feelings of sadness, hopelessness, or despair. While these substances may provide temporary relief, they do not address the underlying mental health issues and can contribute to further physical and emotional harm. Escalation of risk. Over time, substance use can become a crutch, leading to a dangerous cycle of self-medication. This increases the risk of overdose, health problems, legal issues, and strained relationships with loved ones. Key insight: substance abuse can develop as an unhealthy coping mechanism for untreated depression, leading to further physical and emotional harm and complicating the recovery process. 5. Increased risk of suicidal thoughts and behaviors. Perhaps the most serious consequence of untreated depression is the increased risk of suicide. People with untreated depression, especially those with severe symptoms, may experience intense feelings of hopelessness, worthlessness, and despair. Suicidal ideation. The person may begin to believe that they will never feel better and that the only way to escape their emotional pain is through suicide. Thoughts of death or self-harm may become more frequent and intense. Attempts and fatalities. Without appropriate intervention, these thoughts can escalate to suicide attempts or even suicide. Depression is a leading cause of death by suicide worldwide, and untreated depression significantly increases this risk. Key insight: the risk of suicidal thoughts and behaviors is one of the most urgent consequences of untreated depression. Immediate intervention and treatment are essential for individuals who express suicidal ideation. 6. Decreased productivity and career impairment. Depression can have a profound impact on a person's ability to perform at work or school. The lack of motivation, low energy, and cognitive impairments caused by depression can lead to decreased productivity, absenteeism, and difficulty meeting deadlines. Decreased performance. Individuals with untreated depression often find it hard to focus, make decisions, or engage fully in their work. Their lack of interest in tasks and negative thinking patterns can result in poor job performance and missed opportunities. Career setbacks. Long-term untreated depression can affect professional advancement. If the symptoms are severe, it may lead to job loss or underemployment, causing further financial and emotional distress. Key insight: untreated depression can severely affect career performance and overall productivity, potentially leading to job loss or professional setbacks. Conclusion: depressive disorder is a serious mental health condition that should not be ignored or left untreated. When depression goes untreated, the symptoms can worsen, leading to a range of consequences, from relationship problems and physical health issues to substance abuse and even suicidal thoughts. Early intervention is crucial for managing depression effectively and preventing these severe outcomes. If you or someone you know is struggling with depressive disorder, seeking professional help, such as therapy and medication, can make a significant difference in improving mental, emotional, and physical well-being.